A couple that goes to my church began their family by having a beautiful baby girl. The little girl grew into a toddler, and the couple decided that they wanted to add on to their family. For 2 years, they repeatedly tried for a second child. However, when they went to the doctor, the mother was diagnosed with secondary infertility. I have always found the diagnosis of secondary infertility mysterious and intriguing. Fertility is a gift that many families take for granted. I feel qualified to share some information with you all over secondary infertility because I have done a tremendous amount of research over this subject in the past month. I have had close friends who have experienced this disease, and I have studied this abnormality in 2 of my medical classes in school. According to the article, Everything You Need to Know About Secondary Infertility, written by Bonnie Schladel in the 2021 publication of Today's Journal, this disease happens when a mother is able to conceive a child the first time, but she runs into a certain problem while getting pregnant the next time. These consist of a number of genetic disorders or issues related to poor choices the mother makes. You may be asking yourself, how does this relate to me? Funny you might say that. The couple I had mentioned previously had no clue they would be infertile after giving birth to their first child. A news reporter, staff news editor at Pediatrics Week, wrote the article, Viviera Dallas Helps Couples Overcome Secondary Infertility, published on April of 2014 in the issue of Pediatrics Week, states about 1 in 7 couples encounter infertility, and secondary infertility is actually as common as not being able to conceive at all in the first place. Secondary infertility is very common, but many are shocked to discover that they in fact carry the disorder. It is highly likely that this scenario could be your own or even a family member someday. Secondary infertility has a number of causes, effects, and treatments that are not widely known to the public. Let's dive a little deeper into each key factor which impedes the development of a little baby. Secondary infertility is caused by numerous reasons. Isthmus cell is an underrecognized cause of secondary infertility, but it makes up a large percentage of diagnoses. Dewar Ardhana and co-authors of the article Isthmus Cell, an Underrecognized Cause of Secondary Infertility and Pregnancy Outcome After Endoscopic Repair, published in the 2021 International Journal of Reproduction, Contraception, Obstetrics, and Gynecology, gives the following description of what an isthmus cell is and states it's nothing but a defect in the previous cesarean scar, which appears like a niche or a pouch in the anterior wall of the uterus at the area of previous scar on ultrasound and accumulates menstrual blood which floats in the endometrial canal. Here is an example of the anatomy of an isthmus cell in the article Cesarean Section Scar, Unusual Cause of Infertility, written by Dr. Karen Ford. Another cause of secondary infertility is an older age. The article I mentioned previously, published in the Pediatrics Week Journal, talks about how age causes this tragedy to occur by saying the ability of a woman's ovaries to produce genetically normal eggs declines with age, especially after the age 35. Some causes of infertility may also worsen over time, like endometriosis or growing fibroids. Secondary infertility has many emotional effects on the mother of the unborn child. Women who experience secondary infertility deal with feelings of guilt that their husband is not able to become a father. Bartuls today and other co-authors wrote the article, The Emotional Psychological Consequences of Infertility Among Women Seeking Treatment, published in the year of 2014 from the Iranian Journal of Reproductive Medicine, which states, I have tested my husband several times. He is so gentle and never blames me as an infertile woman. This constantly causes my guilty conscience as I think that I am the source of his misery in this regard. Not only do these mothers deal with guilt, but they also deal with severe depression. Their hearts are filled with the sorrow and pain. They are constantly reminded with the fact that they cannot bear a child as silence sweeps throughout their household. In the same article as I mentioned last, another participant in the study gave her honest insight, which read, these issues were generally related to the duration of infertility, and the longer the participants experienced infertility, the more they became depressed. As one of the participants stated, 12 years of infertility is a lifetime. Now I'm completely depressed. I can bear no more. Gynecologists offer both big and small treatment methods. The article, The Impact of Mitochondrial Function Dysfunction on IVF and New Treatment Possibilities for Infertility, was published in the year of 2014 through Reproductive Biology and Endocrinology. Heidi Schatten and co-authors wrote that dietary supplements like CoQ10 increase the amount of immature ovum in the female reproductive system. Endoscopic surgery is another treatment method which would be used to treat an isthmus cell. The article Successful of Atypical of Cesarean Scar Defect Using Endoscopic Surgery, published in the year of 2015 in the BMC pregnancy and childbirth, explains how the process of this surgery works. Hirotaka and Masuda and other co-authors mentioned that a patient that had scar tissue removed, which later resulted in the patient getting pregnant after the third try. With everything I have mentioned in the past few minutes being said, secondary infertility is caused by various factors, can have detrimental effects on the mother, and can be treated in most cases. Let's review. Secondary infertility can come from things such as an isthmocele or scar from a cesarean section, or old age. Next, I mentioned that those who face this uncertainty live through guilt and sorrow. Lastly, treatment methods can range all the way from CoQ10 to endoscopic surgery to remove isthmoceles. I hope you all gained some knowledge about secondary infertility that could potentially benefit you or a family member in the future.